Okay, so they
Okay.
can hear me, so we're good. Okay. Good. Well, hi and welcome. Welcome to my webinar. I'm really excited to be doing this. And again, I'm Dr. Carrie Hastings. I'm a licensed clinical and sports psychologist. I'm based in Westlake Village, California, where I have my private practice. And as Bianca mentioned, I am the sports psychologist, team psychologist for the Los Angeles Rams. Though I specialize in sports psychology, I also see individuals of all ages for therapy and psychological and neuropsychological testing as well. So I know this is kind of a bullying focused webinar series, so I will be touching on that within the realm of sports. But I'm primarily going to focus on how to identify signs and symptoms of distress, which can obviously be a consequence of bullying, and kind of some next steps that you can take from your role, no matter what that may be, whether you're an educator, a coach, a parent, just kind of how to recognize some of those things as we go along. Let me just think. And yes, there is a PowerPoint. You should be able to see it. And I am going to, Bianca, I'm trying to forward to the next slide. Let me just make sure I can advance from my end. I'm going to keep
And it's
talking.
not
I'm
moving.
pressing the arrow key, Bianca. I'm not sure if I should do.
Okay.
And it's not moving.
It's not advancing yet. Um,
Okay.
Maybe we could even try to re-upload it
Yeah.
from
Give
your
me one
end,
second.
and
I'm
I can
looking
tell
for
you when
that.
to advance if that's easier.
Yeah.
So I'll keep talking because I know what the first slide is, so we won't waste any time, and then we'll make sure you can see the slides as we go along. So I kind of like to focus on 4 R's of being able to identify signs and what to do. The first being recognition. So being able to recognize and identify red flags. And so that is basically just within the realm of knowledge and educating yourselves. Well, what do they look like? How would I know? How would I know if that's a sign or a symptom of distress? And by the way, when we say somebody might be experiencing distress or you might recognize a sign or a symptom, that doesn't necessarily mean that they have a formal diagnosis of something. It could, and that's kind of what you are keeping an eye out for the potential of. But it's not your job to diagnose or to be someone's therapist, but just to kind of do what you can within your own role. And sometimes that just means pointing them in the right direction. So being able to recognize what some of those signs are, being able to reach out and knowing how to connect with someone, but it may not be directly. Thank you, Bianca. That's great. It may not be directly to the person. That's not always the appropriate thing to do. So sometimes it may be checking in with other peers or friends of the individual, maybe other teachers or coaches, maybe parents if that's appropriate. Maybe even, if you hear things about social media in this day and age, that's a big forum. So reaching out in whatever way feels appropriate. And then how to start the conversation, because you need to use words that will kind of get the job done. When we're talking about bullying, you want to be cautious of actually using the term bullying if you're checking with someone who you think may be getting bullied. So, in other words, if you approach someone and you say, "Are you being bullied?" they could easily get defensive and put a wall up because of all the connotations that tend to go along with that term. The person may perceive it as, kind of a sign of being bullied as a sign of weakness, or I should be strong enough to not get bullied. They may feel embarrassed about it, and you may not get a straight answer from that. So, knowing the words to use, you want to frame a conversation about that. If it's in the realm of athletics, you might say, "So, how's everything going, on the team? How are all the teammates getting along?" And starting very general and really keeping it somewhat vague, but giving them the opportunity to voice what could be going on with them. I'm going to talk more throughout this webinar about when it is and is not appropriate to refer someone for more professional help and support. So we'll get into that. And then the fourth R of my 4 R's are to remain supportive. So even if you have identified some red flags, you've reached out, maybe you've referred, or maybe you've just provided some support in your own role, even if it seems the situation has passed or you're not sure or they're getting extra help, be sure to check in and follow up with that person, because you want to let them know, if something flares up again or if there's a situation, I'm still here. I'm still here for you, and I'm going to keep checking in with you. Sometimes you're the only person that individual may have. So you can go to the next slide then, and in terms of mindset. So mindset, now this is where really this kind of applies. It applies in the realm of sports. It can apply in the classroom and other settings. One's state of mind and their emotional functioning impacts performance, whether it's on the field, on the court, in the classroom, and vice versa. Depending on how invested the person is, someone's performance then will impact their mood. It doesn't necessarily mean it's going to be problematic, but it could be. So it goes both ways. And that's important to keep in mind, because if you take nothing else away from this webinar, this is crucially important. It is so important to embrace and cultivate someone's whole person. And I'm so passionate about this because I feel that it plays into everyone's daily functioning, but especially with youth and and those that lead them. It's so important to remind people that they are more than their sport. They are more than the outcome of their performance. And I tell athletes I work with this all the time. And, it's easier said than done, because a lot of athletes, especially at the elite level, that's all they've been doing. And their whole identity is embedded in their particular sport. And maybe they've been playing it since they were 4 years old. And, it's all they've ever known. And that's what they're associated with. That's all anyone's ever asked them about. And they haven't really thought much more about themselves. So it may just be connecting with them in a form of asking them more about themselves, asking them about their favorite things. What would you be doing if you weren't playing this sport? If you didn't have this activity after school, what are some of your other interests or passions? But really getting them to think about what else makes you you. And that can really save them in a lot of senses, because at least in sports, the sport won't always be there necessarily, and certainly not at the highest level possible. And when it goes away, whether it's due to retirement or just moving on, losing interest, or injury, it's important that that individual has more to fall back on in terms of their identity and their well-being. The most common things that are likely to come up are symptoms of depression and anxiety. Those are the two biggies. You may see signs of bipolar disorder. That's the extreme highs and the extreme lows, and sometimes symptoms of psychosis even. If you know a person has a prior diagnosis or condition, which you may not, but if you do, that's something to keep in mind if you're seeing symptoms that could be concerning. With athletes, sometimes they can be so committed to the rigors of their sport, and they're so busy that their schedule and their drive and their passion is all poured into their sport, and that can serve as a distraction from what's going on with them internally. That's not always a bad thing, because it can be a healthy distraction. And it's been proven that physical activity can enhance one's functioning, including reducing symptoms of depression and anxiety. Now, it can be problematic if, they're lacking that kind of whole person, and all the facets of a personality that they could rely on, and remind themselves that they, have, and build upon their self-esteem. So sometimes when that's gone, they can be left with a feeling of emptiness. And you may be able to relate to this because often, I know for me, it's at the end of the day when the rest of the world is quiet and everybody's in bed and everything else shuts down, that my mind can start to race. And even if it's just, you're going through a stressful time or you've got a lot on your plate right now, sometimes it's in the quiet that you can feel the most overwhelmed. So, something to keep in mind with somebody who is being bullied, for example, sometimes they can distract themselves from that or the actual emotional repercussions of that. And it may come at them like a truck at the end of the day or in the quiet or when they're alone, making them feel even more isolated. Um, One important thing to remember in the athletic world is that athletes have been constantly reminded about toughness and be tough and, persevere. And all of this mental toughness can sometimes lead them to believe that feeling anything is a sign of weakness, other than maybe celebrating victory. And, while it's important to be trying to win in sports. Yes, it's okay, to try to win, and sports should be competitive. Sometimes athletes or individuals in general, really, are not taught how to lose. They may either be taught how to win or that it's okay not to win, that it doesn't matter the outcome. But that's different than being taught how to lose and how to cope with that, how to cope with feelings of failure. And so it's important that we arm youth with those skills and giving them healthy alternatives for coping, so that they don't use maladaptive coping mechanisms or feel at a loss. I'm noticing a question: do I recommend a minimum age to start athletics playing on a team? Um, I would say, depending on the individual, the youngest would be 4. 5 might be, depending on the development and the maturity of that individual. Sometimes if there are older siblings, 4 is more secure. Sometimes if it's an oldest child, that can still be a little young. And if it's a sport like baseball where there's several innings, even by the third inning they're picking the grass or they've lost interest altogether. Soccer is a little more engaging, so they might last it a little longer. I'd say 5 is a safe age. 4 is okay. Yeah, so it depends on the individual, though. And we can go to the next slide. So these are just some potential triggers for emotional distress. And in sports and in general, a history of trauma can make someone a little more sensitive. Um, Anything domestic and family issues, socioeconomic status, even if the kids aren't aware that there might be economic issues within a family, they can feel and feed off of the stress of parents who may be dealing with that. Um, Injury is always a potential trigger, especially if it's a season-ending injury or a career-ending injury. That can feel like a profound loss. And there have been cases where people have not only have been suicidal and even completed suicide just as a result of their athletic career ending due to injury. Team dynamics, and this is where bullying comes in within athletics. Um, Bullying is a team problem, and it really needs to be dealt that way, even if it's one person between 2 individuals. And it's best addressed at the start of a season, very deliberately by a coach, with a zero tolerance policy, and stating some consequences so that if and when it happens, there are no surprises. If I see or hear about bullying, you will be benched. And sticking to that. Doesn't matter if they're the starter, but really, but sending a message with that. And maybe even some coaches have them sign contracts, and trying to create a family atmosphere. And by that meaning, not everyone's going to be best friends. Families can be very dysfunctional. So the expectation is not for everyone to be best friends, but the expectation is that everyone treats everyone with respect. That is a perfectly legitimate expectation. Okay, next slide. So symptoms of a panic attack. Now I put this on here because if you look at these symptoms, you'll see there are symptoms like your heart racing, sweating, short of breath, might feel lightheaded. These are symptoms, if there are any athletes or former athletes out there that you can feel just during or after a good workout. So, how does one determine if an athlete is just working hard or if they're having a panic attack? And the distinction lies within the star at the bottom there. The panic attack is going to be very abrupt. It's an abrupt, sudden surge of symptoms, and it has to be at least four of these that peaks within a matter of minutes. And typically, a panic attack only lasts a matter of minutes, not more than 10, and then it will start to subside. Whereas if someone's just working out, it's going to be more of a gradual incline to even peak-like symptoms and gradual decrease. And there's not the mental distress that accompanies it either. There's not the worry about something. Although sometimes panic attacks do occur when there's not an identifiable trigger. Just to note that. Okay, next slide. So the biggest sign that you would notice if something's going on with someone is a very sudden, dramatic shift in someone's personality. So you would know someone well enough to be able to just know that something's off. And they may withdraw, they may not engage with peers or teachers or coaches. It's just out of character. And and that's when you want to check in. And you might just say, everything okay? The person, even if something is going on, may not be forthcoming, but they may remember even for later that you did that and use it later. You may notice other behaviors on the opposite end of the spectrum, acting out, outbursts of anger. Um, Adolescents who are depressed show signs of depression in a different way than adults. So whereas adults may you may see the more outward sadness or nothingness, adolescents can tend to be just more irritable, and they may snap at people and kind of have those outbursts, and you may feel like you're walking on eggshells. They may seem disrespectful in a coaching setting. You may see a loss of focus, um, a decrease in resilience, so they're not bouncing back as easily from setbacks or losses or even transitions like substitutions. They may, resist being taken out too early, things like that. Attention and memory is not as sharp. It's just everything might seem slow and heavy. You can go to the next slide. I think there's some more. And that heaviness you can see within athletics, yeah, as just kind of slower reflexes. So a track runner may be slower coming out of the blocks. It's a football player may be slower on the blocks themselves. It may seem like they're tired, just low energy. They may seem restless, and that may be more signs of anxiety, kind of the restlessness, jittery, can't be still, just mind is everywhere. You may see acting out behavior as well, or engagement and kind of excessive or maladaptive coping mechanisms like substance abuse. Okay, next slide. Things that you want to be cautious of. Now, these bullets, the bizarre thinking and kind of just seeing or hearing things that other people aren't, and disorganized speech. So that's like they're not speaking coherently. They can't narrate a thought, like talk about their day cohesively or string together their thoughts in a way that's makes sense. And that's cause for concern. That's where you definitely want to act and get some outside consultation or feedback or bring in a team, because that could signify some psychotic features that you either want to be able to rule it out or you want to get them support as quickly as possible. People who are depressed show it's not always, again, tearfulness or sadness. It might be nothing. It might just be they shut down and it's a lack of expression. And that's called a flat affect. It's just flat. There's just nothingness. Next slide. So you want to kind of look for that too, if there's an absence of expression. So what can you do from your role? You don't need to refer out professionally, but you can contain what they're telling you, what you see, just kind of hold it with them and be there for them. Empathize. The two primary components of providing empathy are narrating what you see and reflecting what you hear. So, let's say someone is breaking into tears and they've told you how they were how they're being bullied or their teammates are ganging up on them, they're being left out. And you might just reflect, I can see that that is really hurting you. You're really hurting, and that's really making you feel sad. And then you might reflect back what you hear. It sounds like your teammates are being unkind and they're leaving you out, and you don't feel like you're part of the team here. And it sounds like you're considering quitting, and really restating what you hear. That not only does that help them feel heard, but you're also kind of checking for understanding and making sure that you are understanding what they're saying. And that's where, don't be afraid to collaborate if it's okay. You may check with the person, and make sure that if you're going to collaborate with other individuals, that it's okay with them and that it's the right individuals. A parent isn't always the best person to go to. Sometimes it can be about the parent. Have some resources on hand to provide with them. If somebody is really kind of in a dark place, that's one of the signs of depression, or even suicidality. If they're talking about death, dying, they seem to be obsessed with that. They may be posting dark images or commentary on social media. Um, you want to have some resources, so give them the hotline, the suicide prevention hotline. Give them a website. Sometimes even, let them, everyone's on their devices these days. Let them use that as a tool. And if sometimes just perusing a website about something that they're going through can just let them know they're not alone with it. Oh, this is here because other people experience the same thing I am. And that can be a comfort. Okay, next slide. Now, when would you refer? So if there is the potential for self-harm or suicide, or the symptoms seem pretty severe, you're seeing any of those potentially psychotic symptoms, or even the level of severity of anxious or depressive symptoms, that's when you want to either consult with a mental health professional, bring in another team member from somewhere. See if you're a coach, check with another coach, see if they're seeing what you do, and if it's consistent. Um, and if there is an immediate danger, absolutely, if they say they're going to hurt or kill themselves, call 911. This is important. Now, if you're wondering if someone is thinking about hurting themselves, ask. Ask directly. Use the words. You will not put the idea in their heads. Are you thinking of killing yourself? If they hadn't thought of it already, then they're probably not. They're not planning on doing it. Um, and if they have, they're going to be relieved. It's been shown that people are relieved when they're asked directly. Okay, next slide. So again, I mentioned most of these. One of the number one predictor of attempting suicide is if you've done it before. And the number one mental and emotional state is hopelessness. So someone can be sad but not suicidal. Once hopelessness starts kind of coming into play and it gets to be at a severe level, that's cause for concern. So you want to check in. You might even ask, what are some of your goals? Where do you see yourself a year from now, or what are you thinking of doing? Just kind of checking in. Again, you're not putting them on the spot. Are you feeling hopeless? You are instead kind of engaging them in a more indirect conversation about the future. Do they see themselves being around for a while? Okay, next slide. Oh, and when you're checking in about suicidality, if they say, well, I thought about it, you want to assess for, do they have a plan? If not, if they're like, no, no, I don't know how I do it. That's good. That's a good sign. If they say, well, I think if I did it, I would drive my mom's car off the bridge at 2 a.m. so there'd be no cars on the road. That's pretty specific, and that is cause for concern, and that's where you absolutely report it. Many of you may be mandated reporters and know a lot of this already. Um, and then you assess for means. Do they have the means? If someone's plan is that they would shoot themselves, well, do they have access to a firearm? If they do, again, that's cause for concern. Many athletes reassure others that they are fine when they are not. It all goes back to that mental toughness and wanting to appear tougher than anything, tougher than anyone, and that they can withstand all. Any feelings that could be perceived as weak, they don't want to reveal. they believe they can persevere through anything, and so they want to convince others they can do that too. Okay, next slide. Okay, so this is just a quick review, and you want to just go into that last bullet. If stuff's going on within the realm of athletics, if they're even like maybe they're not staying on task or they're acting out, check in and see, are they starting to have other issues off the field as well? Are they being a bully? Let's say, maybe they're the aggressors in situations. Something I also want to note too, in terms of bullying within an athletic setting, coaches can be bullies too. There is such a thing as a coach bully, and that's when a coach uses tactics such as intimidation, humiliation, and really can kind of make an example out of someone. They can be very punitive. And you may remember Mike Rice from Rutgers, who would throw balls at his players and even kick his players. It can even get physical. So coaches can be bullies too, and you can have that same kind of bystander effect where people don't say anything or don't say anything for a while. And when it's a coach, it may be because a fear of being benched, a fear of losing playing time. And, they may love the sport so much that they don't want to risk not being able to play it. So that's an issue too, and you want to listen for any stories about that too, or whispers about that, if it's going on. Hazing, by the way, you've heard of hazing, is a form of bullying that's very common. It's like 75% in the collegiate level and close to 50 at the high school level. Is all hazing bad? All hazing is really now frowned upon. There are some things that might be okay, like making the freshmen carry the water bottles is pretty harmless. Some teams have a talent show, something like that. But the problem is hazing is meant to kind of be to humiliate or to demean, to kind of remind people of a hierarchy. And there's a concept called the hidden harm of hazing, which speaks to someone's emotional baggage, to where when hazing occurs, it can trigger an emotional reaction that doesn't seem congruent with the trigger at hand, because it's tapping into whether it's past trauma or something that the person's just really sensitive about. There was a story of a football player whose dream was to play in college, and he got a scholarship and he was there, and then the hazing ritual was that the rookies come in by themselves, and there's an upperclassman or two on the other end of the table, and in the middle is a handgun. And they were asked to hold the handgun to their heads and pull the trigger and say, "I would die for this team." You can see how that type of a hazing ritual is extreme. And it did have a profound effect on this particular athlete, ended up going on a destructive rampage afterwards that no one understood. And what they didn't know was that his parents had divorced when he was 9, and his dad coped with that by holding a handgun to his head and pulling the trigger. They weren't supposed to know that, but I would think that, a little bit of common sense comes into play when you're setting up a hazing ritual like that. The difference, by the way, there's a key difference between hazing and bullying. Though hazing is a form of bullying, hazing is meant to include and bullying is meant to exclude. That's the key difference. So hazing, you're doing it while you're bringing someone into the group. Bullying, you're trying to exclude someone from the group. Okay, next slide. So these are my key takeaways as we kind of wrap up the PowerPoint here. Again, you want to focus on cultivating the whole person of someone, whatever they're involved in, whether it's sports or other things, and emphasizing that the athlete is more than just their sport, and really helping them to focus on all of the components that make them who they are, and that their self-worth should not be determined by the outcome of performance, wins or losses. Just because they lose does not make them a failure. And in fact, it can be an essential part of the road to success. So, having said that, I think I just made it within my take 30 minutes, and I will take a couple of questions and then we can wrap up. I think on the last slide, Bianca, is my email. So I'll take a couple of questions, and then if we, and then any additional, you can feel free to email me at that email address for feedback.
Okay.
I actually do not have your email on this slide, Dr. Carrie. Would you mind letting everybody know your email address?
Sure. It's Ask Dr. Carrie. So ask, and then doctor is spelled out Doctor, Carrie, Carrie.
And then I'll go ahead and resend that to everybody that
At
attended the webinar. So no worries. So if you have any
playlikeachampion.org.
questions, you can go ahead and ask Dr. Carrie. So we do have one question from Debbie Roberts. She wants to know, how do you feel about young children if they make a basket, for example?
So we do have one question from Debbie Roberts, and she wants to know, how do you feel about young children if they make a basket, for example?
Young children. So if you want to give me an age range you have in mind, when you say young, I'm thinking like under 10 or 12. Is that what you're thinking? I He's 8. Okay.
He is 8.
He's 8. So I don't like it. To be quite frank, I think that it's sending the wrong message, because there's something called intrinsic and extrinsic rewards. And what you want to foster, especially at a young age, is that athletes are playing sports for the intrinsic motivation of it. And if you're giving them external rewards, you're reinforcing an extrinsic motivation, which means they're going to be playing for tangible external rewards, not what comes from within, not for the joy of sports, not for their love of the game. And that's what's going to keep them playing. And, there's this whole debate about, should everyone get a trophy and at what age? Some people really see it as a black and white issue. I don't. I actually think that it's okay for everyone to get a trophy up to a certain age, because there is a developmental process and there are developmental stages that we all go through. And when you are young, and by young, so now I'm thinking, Andre, I would say up until about age 7-ish, 7 or 8. I think 6 is still a little 7-ish. That's what we are. We're all about praise and reinforcements, and punishment. We don't do it as much, and so it's okay, I think, if everyone gets a trophy at a young age. Collectively, it's reinforcing. It's because for effort and all that. Now, as you get older, you are developmentally advancing, where you can understand, well, sometimes you win, sometimes you lose. And so I do think you hit a certain point where it's okay to learn that lesson. It's okay for not everyone to get a trophy. And so by that token, Deborah, I would say at 8, I think it's a little young. I don't really agree with giving money just for making baskets. There was a woman I had talked to who had grounded her son for like a month, and then she felt bad afterwards. So then she told him he could take weeks off for hitting home runs in baseball. I don't agree with that either.
And then I actually have a question
I think it's important to foster that
what are some
intrinsic
ways
motivation for
preferably
playing.
high school teams can
Thank you
manage
for the
being in
question.
multiple sports, school, and having a
I
social
actually
life
have a
in a healthy
question
manner?
for you. What are some ways you, preferably high school teams, can manage being in
Sorry about that. I don't know why it's doing
school
that.
and having a social
What
life
are
in a
some
healthy
ways
manner?
you
Bianca,
can
can you
manage
repeat that? I'm
being in
sorry. There's that little
multiple
echo again. I had trouble hearing the
school,
question.
and having a social life in a healthy
What
manner?
are some ways you can manage being in multiple sports, school, and having a social life in a healthy manner?
Great question. So what are some ways to manage, just to balance it all, being in sports, school, social, all of the above? Well, sometimes it's day by day, and sometimes it's hour by hour. I think that for our developing youth is being there for them, not overloading them, not overscheduling. If sleep is so important, it's so important for your mental and emotional health. It's important for performance and whatever activities or sports you're engaged in. You've got to make sure that your kids are getting their sleep, and that your students or your players are getting their sleep, and that they're able to manage their homework and balance it with the sport. You know, it's so easy. There's enough stress as it is, and kids will be stressed, but you want to keep the joy in sports to where that's not adding to their stress. If someone's going to take a test can be stressful as it is. You want to help them be as relaxed as possible through their sport participation and want to be there. So, if you're a coach, you want to foster their love of the sport and make sure that they are playing for themselves, not for you, not for their parents. Um, that they want to be there for them and so that they can manage. And it's okay, by the way, to check in with them about that stuff. As coaches, sometimes kids see their coaches more than they do their own family. So, how are you managing this? How is it going? How is your workload this week? How is stuff at home? Everything okay? It's okay to check in with them about that stuff. And I think the biggest way to help them is to be a support to them and just be present, and encourage them to plan ahead and set goals. You set goals through athletics in terms of long-term goals, short-term goals, practice goals, technique goals, but also set goals in terms of moral goals. What are we going to do today to meet a moral goal? Okay, we're all going to thank the officials. um, Helping them develop as a person. What are we
That's
gonna do for the
great.
community this
If
season?
there's
So a
any more
social goal,
questions,
and just
please
helping
feel
them
free
maintain
to
that well-balanced profile.
Dr. Carrie any questions that you may have
Thank
specifically
you.
to the
That's
email that she
great.
gave you.
If
And I
there's
also just
any
want
more
to go ahead and thank our
questions,
sponsors
please
for this
feel free
webinar,
to
the Riverside Medical Clinic
Dr. Carrie any
and the United Way
questions
of the
that
Inland
you
Valley,
have
and
specifically
especially
for email
Dr.
that she
Carrie
gave you.
Hastings.
And
Thank
I
you so
also just
much.
want to thank our sponsors for this webinar, the Riverside Medical Clinic
Thank you.
and
Goodbye.
United Way of the Inland Valley, and especially Dr. Carrie Hastings. Thank you so much.
Thanks, everybody. Thanks so much. Wish you all the best.
Thank you. Bye-bye.
Bye.